Welcome to Aging with Dignity. I'm your host, Versha. When most people think about dementia, they think about treatment, care, and support after a diagnosis. But what if one of the most important conversations we should be having is about prevention? Research is increasingly showing that many of the factors associated with dementia risk may be influenced by our lifestyle, our environment, our access to healthcare, our education, and the communities in which we live. In fact, some studies suggest that addressing modifiable risk factors could potentially reduce a significant portion of dementia cases worldwide. Today, I'm joined by Dr. Stéfanie Tremblay, a postdoctoral researcher at the Laboratory of Motivational Neuromedicine at the Montreal Neurological Institute Hospital, which is part of McGill University. Her work focuses on understanding the biological, social, and environmental factors that contribute to dementia risk and identifying opportunities for prevention long before symptoms ever happen. In this conversation, we'll explore what the latest science tells us about brain health, why prevention is a lifelong journey, the role of social determinants of health, and what each of us can do to support healthier aging, not only for ourselves, but for future generations. Whether you're a caregiver, a health professional, someone concerned about your own brain health, or simply curious about the future of dementia research, this is a conversation filled with insight, hope, and practical takeaways. Let's begin. Welcome, Stephanie. Thank you for joining us today. Before we dive into the research that you're leading, I'd love for our listeners to get to know you a little bit better. Can you tell us a little bit about your journey into dementia research and what drove you to kind of focus on prevention? And maybe a little bit about the work that you're doing at McGill's Montreal Neurological Institute.
Yes. Hi, Varsha. Thanks for having me. It's really a pleasure. So actually, I used to be an athlete on the national judo team. That might seem weird as a starting phrase, but from that perspective, like to me, exercising, having a good diet, being in a good headspace, those were all things that were very important in my day to day and for my performance. And then I became later aware that these habits can contribute to reducing the risk of many chronic diseases. And at the time, I was doing a bachelor's in kinesiology, so I was learning about this. So I thought that was very fascinating. And then a bit later on, I even learned that these habits were also good to reduce the risk of dementia. So I thought that was super interesting and actually very empowering also to know that these simple actions could allow us to have some control over our health. But a bit later, I realized that I'm very privileged. I grew up in a family where these habits were valued, where we could afford good food. My parents put me into sports. They drove me around to practice every day. So basically, I realized that a lot of factors that contribute to us having a good lifestyle are outside of our control, right? And that's really what got me interested in the social and the environmental factors that contribute to dementia risk.
Okay. And then, so can you talk a little bit about the research that you're presently focused on?
Yeah, so right now I'm doing my postdoctoral fellowship, let's call it, at the neuro at McGill University. And I'm really focusing on those social and those environmental factors. So my goal is to bring more attention to these factors because we know they're really important, perhaps more than a lot of the biological factors that we tend to focus more on. But currently, they don't really receive that much attention, despite their massive impact on health. So researchers often don't collect a lot of data on it. They don't collect these variables consistently. So if we don't measure it, we can't fully understand it and we can't address it either, right? So my goal is really to improve research practice in the first place so that we do collect these important variables, and then improve research practice around how we analyze it so that in the end we can focus our interventions on those factors more.
Okay, so let's start with the big question that really catches everyone's attention. Research is showing that about 40% of dementia cases can be linked to modifiable risk factors. What does that mean? And what should people interpret by that number? What does that mean to them personally?
Mhm. So it's actually even higher than that. According to the last report, it's about 45%. So what that means is that about half of dementia cases could be prevented if we could completely eliminate these risk factors. So we're talking things like physical inactivity, low education, hypertension, smoking, hearing and vision loss, social isolation is also one. And there's a lot. There's 14 of them. And that's across the whole population. Um, so it's important to also remember that these estimates are global, so across the whole world. So we can get more precise estimates. For instance, we know that in Canada, the most important risk factors due to their higher prevalence here is physical inactivity, depression, and hypertension. So those are really like specific targets that we can think of to address here in Canada. And it's also important to remember that these numbers mainly come from studying populations and not so much from studying individuals. So those kind of studies are from the field of epidemiology. So it's really good at telling us what happens across thousands of people, but and it can say with confidence that a population of physically inactive people will have more dementia than a group that is active, but it can't tell us what any single person in that group will get. So, there's plenty of people that will do everything right and still develop dementia, and some who don't do any of these and will not develop it. So that 45% is really something across population. It doesn't tell you about your personal risk. So that's one thing, and there's several reasons for that. One is that there's many of these risk factors. They all combine. They also accumulate over someone's entire life course, um, and so it's complex. So that's why it doesn't directly translate into individual level intervention so well. And that, in my opinion, is exactly why it should be seen more as a public health opportunity rather than as a personal like to-do list. So we know risk builds up over the life course. There's so many risk factors. So, it's hard for one person to really optimize all of that. And we can make a bigger difference by shaping the environments that people live in across their whole life. So, some of the most effective levers are promoting education in the population, um, promoting environments that will facilitate physical activity, like making neighborhoods more walkable, having more green space, sidewalks and bike paths also. Um, making sure that things like hearing and vision care are covered. Those are all things that are best addressed like at the community and at the policy level.
Policy level.
Um,
So it's interesting
mhm.
because you've talked about it being a global issue. You've talked about this really being a policy side concern more so than the individual. Is there any look at the role of ethnicity or gender in the research that's happening? Because I'm sure there's got to be differences based on not only where you live, but your genetic makeup.
Yes, but actually, I think the share of risk is a lot more to do with people's like social environments, and that's true also. If we talk about sex, for sure there are some hormonal differences and some other biological changes, but there's also a lot of the gendered aspects of more women are caregivers, more women will you know um, or actually I should say less women historically have been able to get high level of education and have a job that had like a high complexity, and all those are protective factors of dementia. So there's a big part also that is like that social aspect of gender. And similarly for race and ethnicity, there's actually not that much of a genetic difference between different like racial phenotype, but what's different is the experiences of racism, of discrimination that people from certain racialized groups experience. And then some like cultural factors due to ethnicity or can also like come at play here. As you know, in some cultures like dementia is not viewed in the same way. Maybe it's just viewed as something that has like spiritual meaning or something on the other hand that you don't talk about at all, that it's very stigmatized. So that will also impact, how people will they seek care, will they talk about their cognitive challenges or not. Um, so there's also these aspects, but the genetic part is also um, not as important as we might think. Yeah.
So your work focuses on the brain long before these dementia symptoms that we're familiar with appear. Um, how early do those changes actually begin? Is it, I mean, we're typically, I believe, experiencing it when it's manifesting itself in our home environment. But from what I understand, there's stuff that's happening way longer. How does that timeline really play out?
hmm So yeah, what we know so far, what we think is that these changes in the brain start happening up to 20 years before the person will start experiencing symptoms. But in my opinion, we need to start prevention even earlier than that. So we know that protective and risk factors start accumulating even in childhood. So experiences that people have during their childhood, whether it's that they have opportunities for enriching experiences like sports and arts. Spoke a bit about my own background, being quite privileged with these things, but it's not everyone that were able to have that. And we know that these experiences will shape someone's brain health and mental health, and that will have an impact later in their life. And on the other hand, if people during their childhood were exposed to violence or to other negative experiences, that too can have long lasting impacts on their brain and contribute to worse health as they age and to a higher risk of dementia. So I actually think we need to start thinking more about promoting health and promoting well-being rather than just about avoiding disease. So the same way that we teach kids in school that physical activity and good nutrition is good for the health of their heart, we need to start teaching them what is good for the health of their brain. And like, beyond educating them on that, we need to also provide environments that promote health, right? That those opportunities for learning, for socializing, being active, providing healthy food options in school. So, those are some of the things I think we should think about.
So it's interesting, Stephanie, when you say about 20 years earlier before the symptoms start to present. So if we work backwards, symptoms start to present in your 60s. So if you go 20 years prior, you're for women at least, you're talking menopausal years, right? So
hmm
so many hormonal changes that are happening there. But you're suggesting it should even be happening before, really in our childhood, adolescence, to embrace some of the lifestyle choices that you've talked about. And yes, there may be certain things that, as you said, you came from a privileged standpoint, but there must be things that we can do even if we're not coming from that. We need to figure out what those are, I guess. For someone who might be listening and watching us and wants to figure out ways to protect their brain health, so they didn't start 40 years ago when they probably should have. What are the three big impact choices and changes that they can make starting this week?
hmm Yeah, yeah, like you're right. I'm talking lifespan. That doesn't mean that what we do now doesn't matter. It absolutely does. Like, we know that if we stop smoking today, like it can really reverse some of the changes that have happened in the lungs. And similarly for the brain, if you start today, you can still have an important and meaningful impact. I would say the three things is exercise, socialize, and get your hearing checked. I think that is one that is really overlooked. It's probably the most overlooked one. Um, if you need hearing aids, wear them. It also has an impact on your social life, right? If you start feeling like noisy places with a lot of people are difficult for you, you can't follow conversations, you might start isolating, and we know that social isolation is a big risk factor. We know that social connection is very important to protect your brain. So and your well-being as well.
The hearing is an interesting one because um, if I think back to my mother and her situation, she had hearing loss. She had the hearing aids. She refused to wear them. Her explanation to me was not only is the person that she was speaking to louder, which was what was the objective, but everything in the room was louder.
Mm,
She could hear the fridge more, the microwave, it's like the equipment around the house. And that was just giving her a headache every
mm,
time. So I know the hearing aids have improved as well since the time she was using them. But I found that exactly what you said, the social isolation became a reality. We would be sitting in a big group, and if you asked her, Mrs. Butt, how was your dinner last night? She's had her own conversation going on, and she'll answer you with something like, "Oh, yes, we took all the children from the school to do tree plantation." Something that has nothing to do with what we were just talking about, but she had her
Mm.
own conversation going on in her mind. And we just put it down to loss of hearing. She just didn't hear what we said or misheard what we said. And of course,
Mhm.
like you said, and I've heard this a few times now, that there's a direct correlation between hearing loss and the onset of dementia. So
Yeah.
certainly for any of our audiences that are struggling with
Mhm.
that, let's pay
Yeah.
attention. Let's
Hmm.
rectify that.
Yeah, and at this point, it's even more than a correlation. It's like if it's one of those risk factors that they've included in the Lancet Commission, which actually means we think we have strong evidence to believe that there's a causal relationship that um, that hearing loss may really have contributed to um, like cognitive decline and dementia. So yeah, it's I hope that they have improved the hearing aids that we have
I believe they
nowadays
have.
because
Yes. Yeah.
yeah.
Yeah, they're much more focused on the person that's speaking, and it drowns out a lot of the background noises. I don't know the technology behind it, but that's what I've heard. Um, you also look at cardiovascular health and brain health. Can you talk a little about the connection between them, like between the heart, our blood, dementia risk?
Hmm. Yeah, so the simplest way to put it is that what's good for your heart is good for your brain. And that's because our brain needs a lot of energy. It's very hungry. It's only about 2% of our body weight, but it uses around 20% of our blood supply. So it really depends on a dense network of blood vessels that will deliver oxygen and nutrients, in time. So anything that damages your heart or damages your blood vessels, that will basically starve your brain that needs this constant supply in energy. So things like when blood pressure is too high or cholesterol builds up or diabetes damages the blood vessels, any sort of damage to the blood vessels over time that can cause like small strokes, and sometimes they're so small that you won't notice them, and then that reduced blood flow to certain areas of the brain will injure brain tissue. um, so that's like the most direct path, and it's called vascular dementia. But it's also important for Alzheimer's disease because a brain that has like less blood supply, that has poor blood supply to some areas, that brain will be less able to clear out waste and to withstand damage. So vascular problems can accelerate sorry, Alzheimer's too. Um, but the encouraging part is that we know how to modify a lot of these risk factors. So, managing blood pressure, physical activity, diet, avoiding to smoke, those are all things that will protect our blood vessels and protect our brain at the same time.
So you've talked already a couple of times now about the individual choices that we can make, and I hope my audiences are able to identify those clearly now and make some of those changes if they should want to see that impact on potential dementia and the risks that come from it. But you've also talked about the social side, the policy side of this. Are there specific changes that we can try and influence at a community level? What would you want to see happening at that policy community level to make the biggest impact on what we're seeing with dementia?
Hmm. Yeah. So I would think about it in three layers. And the first one I think is regulation and policies. Um, so, for instance, things like reformulating processed foods to cut sugar, cut salt. Those are things that we know can really like reduce health problems later on. Establishing minimum pricing for alcohol and tobacco. So those are very sort of like market regulations, but we know they work. With tobacco, we've made large improvements due to these sort of policies. Also, like restricting the marketing of harmful products, and I think that was one like a big one with cigarettes is also. We used to market it as something that was like elegant and cool to do, and now we don't see that anymore, and that has really contributed to decreasing the tobacco use and decreasing, like reducing a lot of the health effects, like the negative health effects it had. The second one is so in the first one is kind of like making the unhealthy things harder. The second is making the healthy path the more accessible, the easier one, right? So making neighborhoods more walkable, public coverage of things like hearing aids, psychological support. Also, we tend to think of our system like we have universal public healthcare, but it's not so true for some of the more preventative care. So, things like I know that for hearing aids, it's a little bit patchy. It's not perfect. If you need the psychological support, it's really hard to get access to a psychologist. If you injure your back and you don't have private insurance to get the therapy that you need, then you'll probably stop exercising because it hurts now to exercise. So it's all those preventative things are not covered by our current system. Um, so yeah, actually, like prevention at this point is a bit something you have to be able to afford, which is unfortunate. So both of these layers are sort of still treating the symptoms, in my opinion, like we're treating the conditions. But if we really want to move the needle in dementia and on health inequities, which is what personally interests me the most, we have to address those socioeconomic inequalities um, that underlie them. So things like progressive taxation, basic income, it really shocks me that even in Canada, there's large and actually widening gaps in like between the richest and the poorest people. So we know that the poorest people live 5 to 8 years less, and there's an even bigger gap in health expectancy. So the years that we live in good health. So yeah, many of those dementia risk factors, low education, untreated hypertension, hearing loss, they end up in the same disadvantaged groups. So if we reduce those inequalities, that, in my opinion, may be the most effective dementia prevention that we have.
Yeah, those are big asks, but
Yeah.
I think they are very much needed asks, and I really appreciate the way you've laid that out with the 3 layers. And of course, you've also identified on the individual side what we can do to take control ourselves, where we can. So I think that's important for us to understand that. If we look ahead, what developments in research do you see happening? Brain imaging or detection, early detection that gives you hope for the future of what dementia could look like in Canada?
hmm So to me, actually, what gives me hope is that in research now and in dementia research, we're shifting more and more to a more participative approach. So we're involving patients, we're involving caregivers, citizens, even maybe like people from marginalized groups that are more at risk of a certain disease. We're involving them more in the research process, not only as participants but as full participants of uh, as full collaborators, I should say, in the research process, in designing studies and establishing priorities. So I think this shift is very much needed, to finally listen to people's lived experience, right? They're the experts in what is actually to live with dementia, or how is it actually to care for someone that has dementia. So I think it's really important that we start including them more, and we're doing it um, like a lot more nowadays, and we are doing it in my research, which has been really enriching for me, really. So it's really allowed me to see things differently, and I'll give an example. Recently, I was facilitating the first ever cohort of the Delight program at the Montreal Alzheimer's Society. So it's an 8-week exercise program for people living with dementia and their caregivers. So they're really both part of the program. They come together. It was physical activity, but it was also about the social connections between the different participants. And there was like a lot of time for exchange around strategies for or resources or healthy lifestyle habits. We would talk about nutrition, about cognitive stimulation, about um, and those are some interventions that we normally think of as preventative interventions, for people that don't have dementia.
Mhm.
Um, which it really made me realize, like, prevention shouldn't stop at diagnosis. For other conditions, like for cardiovascular disease, we think more about secondary prevention and tertiary prevention, which means even once you have a cardiovascular conditions, there are things we can do uh, to ensure that the disease doesn't progress so fast, to prevent future cardiac events, to prevent other complications. And I think we don't do that enough for dementia. Think we need to use more like those non-pharmacological intervention or those lifestyle interventions to support people that have dementia so that they can live well with dementia and have a better quality of life. Um, so yeah, that's something that gives me hope.
It's interesting because I think you're right. From most of what I'm hearing out in the market is you've got prevention on one side, and then you've got diagnosis and treatment. Um, and I think you're right. I think there's a role for prevention to help delay at least. It may not reverse it yet, but even once a diagnosis is there, can we continue to take on some of these aspects of prevention and incorporate it into the activities that are being done to help maybe delay and defer the more aggressive progression of
Mhm.
dementia. So I think that's a great point. I love that you were able to work with the Montreal Alzheimer's group. Um, they certainly would have received value from that. Were you able to capture data that you then take back into your research from that?
So interestingly, I'm a researcher, but I really took on this role as almost like a, because as I mentioned in the beginning, I did my bachelor's degree in kinesiology, so I had that background in how do you train people, and I was able to kind of take that background and also the theoretical knowledge I have about dementia, to bring it together and facilitate these sessions. But I wasn't involved in the research aspect. I was really just involved in the delivery, which was an an interesting other angle that I don't get to have every day. But it really it really inspired my approach to research, though, because it helped me view things from this angle, where I used to be very focused on prevention and on people that are cognitively healthy or that are at risk. um, but now I view prevention, or rather I would say brain health promotion, as something that has no barriers. It doesn't have a frontier at diagnosis where it stops. It's throughout life, from childhood up until death, right? We should always be trying to promote brain health and function, and also figuring out what matters to people. And if that person has a dog and they want to be able to like walk their dog, that is really important to that person, and we should try to support them in being able to do that for as long as possible. Yeah.
It's interesting because if I share my mother's example, which is of course just anecdotal, but even at the last stages, my mother had a very rare form of dementia. It's corticobasal degeneration, CBD. So it presents like Alzheimer's, the loss of the memory, but also presents like Parkinson's, the loss of the motor skills. So at a certain stage, she was pretty much bedridden. But we started having someone come in to do the exercises with her. It was limited movements, and it was guided movements, but she was always better off after the session, and it got to a point that when the person would come and we'd say, "Okay, mom, it's time to do the exercises," she would actually smile. She wasn't able to
Mhm.
communicate with words, but we knew that she was looking forward to that. So there's something about that whole, like what you're saying about the physical. I mean, the physical exercise for her was basically moving her legs, but that was stimulating her. And yeah, so it's anecdotal.
I wonder if there's something also about maybe like the presence of that person coming in to help her and be with her. Like we often think, we could have seen these exercises as a delight, as like physical activity purely, but I think people benefited even more from the social aspect of just being with other people that share maybe similar experiences, or not, maybe just someone who's there and who's there to help them, and that feels good to them.
Absolutely. Stephanie, you shared so much of taking the research that's going on and bringing it into consumable bites for us that are, the common folks that we are. We're not involved in all of the research, but we're experiencing the reality of dementia on our families. So I appreciate what you've done there, bringing it down into very consumable bites. If there was one message that you could leave for every Canadian to better understand dementia prevention and brain health, what would it be? Your final thoughts for our audience.
hmm I think it's that it needs to be seen as a collective responsibility. So things like getting involved in your community, volunteering, voting for policymakers that value brain health and value equity. Those are all things that we can do individually, but that will benefit the brain health of others around us, in addition to our own, obviously. The other thing is that dementia prevention. Can I say three messages? I mean
Sure.
one. That's one. They're short. The other one is
Absolutely.
that dementia prevention goes beyond just the health sector. It covers pretty much all areas of life. You can think about it in terms of urban design, because we know our environments will shape our health habits. The education sector, obviously, the housing, and the list goes on. So we need to stop seeing things in those silos and start understanding it more as something that really encompasses a lot of areas. And lastly, I said it a lot, but it should occur over the entire life course. We need to think about promoting brain health throughout the entire life. Yeah.
100%. I said it was your final thoughts. I do need to comment on it though, because you raised an interesting point, and I've done other episodes on this, but the concept of compassionate communities is something that we're seeing in parts of Europe, hoping to start to see this coming more and more into Canada. Even before they become formally established as such, I think every one of us can actually create that compassion amongst our communities. Our community could be the building that you're living in. It could be the religious group that you're part of, or the social group that you're part of. Everyone has could be your neighborhood.
Mhm.
But being able to reach out and support each other, I think we need to get back to that. We've moved away from that idea of community, and that's where we're going to get our strength from. Yes, we want policy to change, but it should be supporting what we're already doing in our local backyard. So I appreciate really that you brought that topic up. Um, I thank you for joining us, Stephanie. It's been wonderful having you here, and I will continue to watch your research as it comes forward and see how it can continue to influence all of us as we go forward too.
Thank you so much for having me. It was great.
My sincere thanks to Dr. Stéfanie Tremblay for sharing her expertise and helping us better understand the growing field of dementia prevention. One of the messages I take away from this conversation is that brain health is not determined by a single choice, a single habit, or a single moment. It's shaped over a lifetime by how we care for our bodies, our minds, our relationships, and our communities. For caregivers especially, this message carries an important reminder. So often, caregivers put their own health at the bottom of the list. We focus on appointments, medications, daily routines, and the needs of those we love. Yet the very things that support brain health, physical activity, social connection, quality sleep, managing stress, regular health checkups, meaningful engagement, and of course, those moments of joy are often the first things we sacrifice. Today's conversation reminds us that caring for ourselves is not selfish. It's one of the most important investments we can make in our own future and well being. So, my invitation to you this week is simple: choose one thing, take a walk with a friend, schedule that overdue medical appointment, join a community group, prioritize sleep, spend time doing something that brings you purpose or connection. Small, consistent actions can make a meaningful difference over time. As always, I ask that if this episode sparks something for you, please share it with your family, friends, or anyone you care about. These conversations help us build awareness, reduce stigma, and create communities that are better prepared to support aging. And don't forget to hit like, follow, and subscribe to this podcast so you never miss an episode. Thank you again for listening in and sharing your time with me. And please join me each week for new insights into aging with dignity. Until next time, reminding us all to age gracefully and live vibrantly. Everything you've heard today, just real talk. It's just our personal stories, experiences, and honest opinions. This podcast isn't providing legal, medical, financial, or therapeutic advice. And no, listening doesn't make me or my guests your lawyer, doctor, financial advisor, or therapist. The guests and I are here to share stories, spark ideas, and hopefully give you something to think about. When it comes to the big decisions, make sure you do your homework or check in with the experts who know your situation best. We're here to keep the conversation going. You're the one in the driver's seat.